Sinusitis is basically, see, we have empty cavities inside our skull. So we have right here, we call frontal sinus. There's empty space here. There's empty space here. There's empty space here around the nose. And there is one more behind the eyes. So this is called frontal sinus. This is called maxillary sinus, ethmoidal sinus, and back is called sphenoid sinus. So the sinuses are basically empty cavities lined by mucosal epithelium. So once the mucosa gets infected or inflamed, or the mucus gets accumulated inside, it's called sinusitis. One is infective sinusitis, when there is pus inside the sinuses. That's called infective sinusitis. And then the next would be allergic sinusitis, when there is no pus but there is allergies. And the third would be allergic fungal rhinosinusitis, which we call AFRS, so which is again immunity-based disease. And then we have invasive fungal rhinosinusitis. The fungus is invading the tissues and eating up the tissues. That's a deadly disease, which was very common during COVID time. When people used to get this fungal sinusitis. And so these are the types of sinusitis. The most common is deviated nasal septum. When you have a nasal septum which is dividing the two nasal cavities into left and right, if that is deviated towards one side too much, then it creates blockage to that side of sinuses, and those sinuses tend to get blocked and tend to develop secretions inside and resulting in sinusitis. Then second is allergies. Allergies to maybe environmental allergens, or maybe some food allergens as well. So these allergies can cause inflammation as well. And and the third is low immunity. When the immunity is less, you can get fungus. That's called fungal sinusitis, or allergic fungal rhinosinusitis. So these are the main causes of sinusitis. One would be nose block. Then there will be facial pain, heaviness, forehead headache, what we call frontal headache in this area. And there'll be a lot of mucus coming out of the nose when you blow, colored mucus, like not transparent. And there'll be throat symptoms as well because of the mucus falling down, what we call postnasal drip. The mucus falling down into the throat will cause throat irritation and cause pharyngitis as well. And patient will have constant irritation in the throat. Overall feeling of, being unhealthy, not feeling like working, lethargic. These are the usual symptoms of sinusitis. That depends upon what is the cause. So if it is an acute sinusitis, like within 3 months, not longer than 3 months, we tend to treat it medically. We give antibiotics, we give nasal washes, nasal douches, nasal sprays, anti-allergics, decongestants, and stuff like that. But if it's longer than 3 months and repeatedly happening, then we go for a CT scan. And if there is chronic sinusitis, on the CT scan, we plan for a surgery called functional endoscopic sinus surgery. And if required, septoplasty to correct the septum. And it's quite successful in almost 99% of patients. If the patients are chosen properly, it's quite successful. There's nothing you can do to avoid. If it's going to happen, it's going to happen. The best thing would be to avoid, if you have common cold and if it's lasting for more than 5 days, then you must treat it by meeting a doctor. If it stays longer, then it is going to end up becoming a sinusitis. So that's the only thing one can do. Cannot let the common cold be there for more than 5 days. More than 5 days, you must treat it. Otherwise, eventually it's going to become sinusitis. And get treated for it. Don't sit on it because it can lead to multiple complications.